Right now, Virginia is experiencing an outbreak of meningococcal disease. Health officials say most of the people impacted are Black or African American between 30 and 60 years old. The disease is rare but very serious. Since June of 2022, there have been 27 cases in the state. The Virginia Department of Health says the number is 3 times higher than the expected number of cases. 26 of the 27 patients were not vaccinated against the disease, and 5 people have died in the outbreak. Joining us now to talk more about this is Dr. Kumer. He is the Associate Medical Chief Officer for the University of Kansas Health System. So, Doctor, thank you for being here. We'll start by asking, how is this disease spread?
Thanks for having me, Kelly. This is oftentimes spread with bodily fluids, such as somebody sneezing or not contact with that, not washing hands, and so forth.
And what is the impact of this disease on the body?
Well, it can be very serious. Folks that are not vaccinated and don't have immunity can sometimes have serious effects and can even lead to death and loss of limb.
I'm assuming that a vaccine would be the #1 way to prevent being infected. Is that correct? And if so, what are the other ways that people can protect themselves as well?
I think you hit the nail on the head. Absolutely. As you saw and said at the top of this segment, 26 out of the 27 people that obtained this disease were not vaccinated. The best thing you can do is really wash your hands and have good hygiene.
So I'd love to get your take on another medical headline we've been following. The ADHD medication Ritalin could help end cocaine addictions. This is according to a new study. Researchers currently looking into whether or not the medication could be used to wean users off the drug. Animal studies seem promising. However, the results in people are mixed. And Ritalin works similarly to cocaine, but scientists say users are less likely to abuse it. About 25,000 Americans die from cocaine abuse each year. So what are your thoughts on this research, Doctor?
Well, it's very interesting. It kind of borrows off of the story with methadone. Methadone has been used for narcotic abusers and getting them off into a maintenance program. This is very similar in that cocaine stimulates dopamine receptors and euphoria and a reward mechanism. Ritalin and Adderall contain amphetamine derivatives that have that same effect, although not quite as strong. So weaning somebody off this certainly makes logical sense.
So if scientists are able to determine that this works in humans, do you think this is a good approach?
I think it's a start. Obviously, there are millions of Americans abusing cocaine, and it leads to a significant amount of deaths, and directly from the drug as well as the drug war. So absolutely, I think anything we can do to get folks off this dangerous drug is worth examining.
What is your best advice for those who are suffering from addiction or who have a loved one suffering right now?
I think get them support them. They're in need of help. Get them to their doctor, get them to ER, get them to the necessary rehab programs that are out there. Look for help. That's the best thing we can help folks do, because they are sometimes asking for it and it's hard to really see, and they're suffering with that addiction.
Yeah, certainly. So many across the country are. Another new study found taking vitamins or dietary supplements could be helping cancerous tumors grow. Scientists determined that supplements like vitamins A, C, and zinc can actually accelerate the growth of blood vessels in cancer when taken in excess. Still, scientists say that natural levels of antioxidants in food are safe. So curious, what are your thoughts on this research?
Well, antioxidants are a good thing. They scavenge free radicals and reactive oxygen species within our bloodstream and our body. But if you use them too much in excess, it could stimulate angiogenesis. Angiogenesis is stimulated by a protein that's being pushed by these antioxidants. And as a result, that protein stimulates blood vessels. Cancers live off of blood vessels, and as a result, it could create an environment that's pro-cancer.
Who should reconsider taking supplements, if anyone, in your view?
I think, the people that have had a history of cancer are probably at particular risk, or if you have a significant history, family history, beyond personal history, those folks are probably okay to take regular doses of antioxidants, but not large amounts.
Thank you for watching. Go to newsnationnow.com to find NewsNation on your television provider. And don't forget to click the red subscribe button below to get more of NewsNation's fact-driven, unbiased coverage.